So important topics of hospital administration management. First, the legal aspects of administration. All the legal aspects are important. Specifically, the what is law, maintenance of medical record, high quality patient care, compulsory duties, voluntary duties of doctors, medical legal case, Consumer Protection Act, consent, and the tier system, consumer redressal agencies, law of torts. These are important from legal aspects of hospital administration. Then from the chapter of planning, all the topics are important. So it's a like we can't miss any part of it. All the steps involved in planning, different types of planning, hierarchy of plans. Okay, objectives, so MBO, management or by objectives. Okay, all these are important. Next is decision making. Page number 71, 78 to 81. Only that part you have to study properly. Types of decisions, steps, factors influencing, qualitative and quantitative basis of decision making. That's it. That's what is important. Job designing, all topics are important. It's a single page chapter. Enrichment, enlargement, skills needed. Then directing, all topics, principles of directing, human factors in directing. From the chapter of motivation, motivating, all topics, again, the motivation formula, motivation equals to valence into expectancy. Reaction to non-satisfaction of needs. All the theories of motivation, very important. Then leadership, again, all topics, types of leadership, authority and power, influencing, leadership styles. Small chapters, okay. Then hospital planning, page number 187 to 193, which includes aims of hospital planning, definition of hospital, factors affecting hospital planning, ownership, types of hospital, depending on ownership, directory, systems of medicine, etc. And hospital planning process, very important, from conceptualization of hospital, support groups, temporary organization, securing funds, feasibility study, community diagnosis, organization and governing board, that table, hospital architect's brief, hospital zones, very important, hospital system, hospital zones, types of engineers, water requirement, electricity, hospital project management. So these are the topics that comes under these page numbers. In your new textbook, you can just mark these page numbers as important. Next is outpatient department. All topics are important. Okay, types of OPD, physical facilities, functions, patients area, etc. Managerial issues, very important chapter, part of the chapter. Then emergency services also, types of emergency services, this chapter as well, types of emergency services, physical facilities available, circulation, staffing, policies, record maintenance, medical legal cases, grievance redressal system, disaster preparedness, code blue. Then inpatient department. So again, in this, on page number 224, what are inpatient department? Okay, the components in that, functions, planning and designing of ward, teachers, different types of arrangement, circulation and inpatient department, arrangement of vertical, horizontal, different types of ward, Nightingale ward, Riggs ward. Then components of a nursing unit, primary accommodation, ancillary, auxiliary, sanitary, nursing station. Then personal management, managerial issues. About nursing management, much you don't have to study. Managerial issues, personal management, that's what you have to study. Then operation theater, all topics. Aims of planning, criteria of planning operation theater, location, orientation, physical facilities available, policies and procedures, staffing, monitoring of asepsis. ICU, again, all topics. Different types of ICU functions, physical facilities, staffing, policies and procedures, equipments used, quality assurance policy. Then laboratory, page number 266 onwards. Laboratory services, types of laboratories, components of laboratory, organization of both pathology laboratory, regional laboratory, intermediate hospital laboratory, staffing, equipments and reagents used, quality assurance program in laboratory, quality control assurance, control policy, quantitative test, internal quality control, external quality control. The formulas, no need to study the formulas. Quality assurance, NABL, TQM, just go through it. Then radiology services, different types of radiology, diagnostic radiology, therapeutic radiology, types of services, physical facilities available, general area, storage area, diagnostic area, all these areas. Film processing and distribution area, no need to study because it is not available in hospitals these days. Physical facilities for specific equipments, staffing, policies and procedures. Then radiotherapy also. What is radiotherapy? Location. Equipments used in radiotherapy. Policies and procedures. And transfusion services. Definition, functions of blood bank, physical facilities of a blood bank, all the physical facilities you have to study. Tests done in a blood bank. Equipments, just go through it, no need to by heart anything. Policies and procedures. Selection of donors, bleeding donor, deferral of donor, very important. Labeling and storage of donor blood, but tests of donor blood. Court judgments, no need to study now because it has changed a lot. Then medical records department, all topics. What is a medical record department? Purpose, scope, medical legal importance, retention of medical records, steps, processing of medical records, which include steps like coding, indexing, storage, filing system, methods of filing system, physical facilities in MRD, staffing, managerial aspects, policies and procedures. Let us study that. Then CSSD. So what is CSSD? Types of it, different names of it, aims and objectives of CSSD, workflow, physical facilities, again important, different types of sterilization equipments used in CSSD, the operation method of CSSD, from that steps are there, 9 steps are there, managerial issues in a box they have given. That much is important. Then housekeeping, all topics. What is housekeeping? Functions of housekeeping services, types of housekeeping services, in-house, outsourcing, activities in housekeeping, cleaning agents used, the 5S method. Then transportation. Excuse me. So types of transportation, internal, external. What is ambulance? Types of ambulances, Rao committee report, role and functions of ambulances, physical facilities required for ambulance. Excuse me. Equipments that you find inside ambulance, important, staffing, care of ambulance given by Rao committee. Then waste management, all topics like classification of hospital waste, categories, importance, the generation and segregation of biomedical waste, the steps involved from generation, source of waste, classification, quality, quantity, segregation, collection and storage, color coding, transportation, treatment of waste, different types of treatment methods like chemical, disinfectants used, thermal method, autoclave, hydroclave, microwave, incinerators, mechanical methods of waste management, disposal of waste, managerial issues in biomedical waste management. Okay? All this is important. Then occupational safety. All topics. What are the different types of occupational hazards? Physical, chemical, biological, mechanical, psychological. Okay. So these are the occupational hazards found in hospital as well. Okay, the relation between man, machine, man and physical. Okay, that you should know. In administrative also, how can you contract it? The problem solving of occupational hazards, you should know that. In CSSD, radiology department, dietary services, bloodborne, fire hazard, machine based hazardous chemicals, slips, trips, falls, workplace violence, sharps and containers, laser plume, equipment based hazards, allergies, heat stress, morgue, workplace stress, terrorism, work practices and behavior. All this you have to know what is it and how you can, what solutions you can give to overcome these hazards. You can WhatsApp me to get the recorded video of this class, the link Then quality in healthcare. What is a product or service? Absence of deficiency, customer satisfaction. What is a customer, external, internal? Components of quality. Feedback system. Why do we need a feedback? And all the different feedback system, from comment cards to frontline people, communication, frontline people, total quality management, organizational analysis in hospitals, SWOT analysis, quality manual, hospital information system, structures of standard of structure, standard of process, standard of outcome, medical audit. That's it. That's important. Accreditations, you will have studied about in the quality management as well. That is more than enough. Having the awareness of accreditation, NABH, JCI, ISO. Because it keeps on changing every year, so we can't by heart it. Then media. What is media? Okay, the power of media. Developing good media relation programs. How the media works through reporters, correspondents, drinkers, feature writers, agencies, picture agencies, libraries, PR stores, contributors, all that you have to read. Principles of good media relation, 5 F's in media relation program, how to develop it. Do's and don'ts. Then telemedicine, the technology, the history of telemedicine, no need to by heart it, okay? Read the technology part. Different transmission technologies that is available, like wireless cables, optic cable, radio-based, microwave link, satellite technology, different networks that you use, end-to-end user equipments, what you should have, internet services, application in healthcare, how do you use this telemedicine in healthcare, managerial issues. That's it. Medical tourism, briefly, you have to study what are the factors that affect medical tourism. Okay, how is India good in medical tourism? Accreditation of healthcare hospitals, risk and benefits of medical tourism. Destinations, that is for your knowledge, no need to by heart. Then the annexures, it's about your code of medical ethics, what we have studied in the recorded sessions, that is more than enough. Okay. Duties of the physician and all, the code of medical ethics. Just read that. Medical termination of pregnancy, read that. And the recent amendments, okay, in textbooks, some amendment point they may have missed. So use your internet sources to have an awareness of it. TUA Act, transplantation of human organs and tissues. Okay, the TUA Act, and PC and PNDT, Prenatal Diagnosis Act. Okay, medical termination of pregnancy, and code of medical ethics. Okay, this is what you have to study. No need to by heart, just the concept of these acts, that is more than enough for you to know. So sample questions, you can see here, biomedical waste should not be stored beyond. The right answer is 48 hours. More than 48 hours, a hospital or a healthcare facility is not allowed to store biomedical waste. Okay. Recommended number of ambulances under Rao committee for a 150-bedded hospital is 3 ambulances. According to Rao committee, for every 50 bed, 1 ambulance should be provided. Okay, so if you have read transportation chapter, you will be able to answer this. Okay, and also it is going to be an open textbook examination. Okay, so make sure you have at least gone through all the chapters 2 to 3 times, so that when a confusing question comes around, you can just open the textbook and see what the correct answer would be. Okay, but even to open the right page number, You can't sit with one chapter turning the pages to find one answer. Okay, it can only come to you if you know where a paragraph is, which from which chapter this has come. Okay, which paragraph, which page. Only if you have read the textbook you would be able to answer this. Okay. So if you have any queries, please mention in the chat box.